Hey guys, it's Morgan Lima, owner and founder of Hand to Heart CPR and First Aid Training LLC. I've been a nurse for nearly 10 years and a nursing instructor for 4. And today I want to talk to you guys about how to remember antibiotic endings. While antibiotics are powerful weapons against infection, navigating their complex world can be daunting. And with so many options, remembering their names and uses can be a real challenge. And that's where we come in. We're here to help you learn how to best remember antibiotics. So let's start with antibiotic classes and drug names. Start familiarizing yourself with antibiotic names by studying the classes of antibiotics and examples of common drug names. So here's a list to just get started. The first is penicillins. There are 5 groups of antibiotics in the penicillin class. A few common drug names include amoxicillin, ampicillin, and oxacillin. Next, we've got tetracyclines. Tetracyclines can be used to treat acne, among other infections. Some generic tetracycline drugs are tetracycline, doxycycline, and minocycline. Now, tetracycline, you'll realize, is identical to the class name, and you're going to see that pop up every now and then. So those are just easier to remember. Next, we have cephalosporins. There are multiple generations of cephalosporins. Each generation is grouped based on the bacteria type they're effective against. Check out these 3 examples. We have cefotaxime, cephalexin, and we've got cefepime. Next, we've got fluoroquinolones. These are strong antibiotics, and there are strong warnings against fluoroquinolones due to their serious side effects. Examples of this drug class include ciprofloxacin, levofloxacin, and gemifloxacin. Lincomycins are used to treat serious infections. Some generic drugs for lincomycins are clindamycin and lincomycin. Again, we've got those drugs that are named after the class. Next, we've got macrolides. Macrolides often treat whooping cough, community-acquired pneumonia, and simple skin infections. We have azithromycin, clarithromycin, and fidaxomicin. Next, we've got sulfonamides. So sulfonamides treat UTIs and ear infections. We've got sulfamethoxazole and sulfasalazine. Glycopeptides. Glycopeptides are used as a last resort to treat infections resistant to other antibiotics. 3 drug examples are telavancin, vancomycin, and oritavancin. Aminoglycosides. Aminoglycosides are quick to kill bacteria and are typically given through the vein. Some examples are gentamicin, tobramycin, and amikacin. Carbapenems. From kidney infections to pneumonia, carbapenems treat serious infections. Names for antibiotics in this drug class include meropenem, ertapenem, and impenem. Easy ways to remember antibiotic endings. So now you know some drug names for antibiotics, but the easiest way to remember them, studying with picture mnemonics. From helping future pharmacy technicians master meds to nurses acing pharmacology in nursing school, Picmonic has a vast picture mnemonic library for pharmacology. Picmonic is research proven to improve test scores and increase retention. It's an effective approach to conquering the learning curve, studying medicine facts, and memorizing antibiotics. Master topics with unlimited quizzes and engaging Picmonics for medications. You can explore their library and you can sign up today. So, what is in a name? For antibiotics, it's mice, cycles, oxen, and chefs. Who knew? Antibiotics have all kinds of suffixes, stems, and prefixes. Check out our infographic and these common antibiotic endings to kick off your studying. Let's start with mycin. The mycin antibiotic class is aminoglycoside or macrolide. They inhibit protein synthesis in bacteria. Next, we've got cycline. Antibiotics ending in cycline are tetracyclines that interfere with protein synthesis and are used to treat a wide range of bacterial infections. A brand name cycling antibiotic is tetrasin. Next, we've got the ending thromycin. Antibiotics ending in thromycin, like azithromycin, clarithromycin, are macrolides that inhibit protein synthesis in bacteria. Floxacin. Antibiotics ending in floxacin, like ciprofloxacin and levofloxacin, belong to the fluoroquinolone class. They inhibit DNA gyrase and topoisomerase, disrupting DNA replication and repair in bacteria. Next, we have ceph, which can be CEF or CEPH. The antibiotic stem, ceph, represents a specific class of antibiotics known as cephalosporins. Cephalosporins are a group of beta-lactam antibiotics closely related to penicillins in terms of their structure and mechanism of action. Leading us to psyllin. Antibiotics that end with psyllin represent the penicillin class. Penicillins attach to and damage the walls of bacterial cells, eventually destroying them. Next, we've got sulfa. Antibiotics with sulfa are part of the sulfonamides, which inhibit converting p-aminobenzoic acid to dihydroterate. Bacteria need dihydroterate synthesis, or DHPS, to help produce folic acid to multiply. No production, no growth. Lastly, we've got penem. If you guessed that penem is part of the antibiotic class carbapenems, you're right. Like penicillins and cephalosporins, carbapenems are part of the beta-lactam antibiotics and treat severe bacterial infections. This is a very basic and brief overview of a really complex topic. But if you take this complex topic of antibiotics and break it down into more digestible pieces, you're going to be set. So use your resources, use Picmonic, and you've got this.